So you've not had a poo at least 3 times during the last week, or maybe you find that your poo is often large and dry, hard or lumpy, or perhaps you're straining or in pain when you go to the toilet. If this is the case, the chances are that you might have constipation. And in this video, we're going to cover what it is, as well as causes, 5 ways that you can treat your constipation at home, and finally, when you should consider seeing your doctor. So first of all, what causes constipation? Well, it's important to note that constipation is common and it affects people of all ages. You can usually treat it with simple changes to your diet and lifestyle, but sometimes you might need to see your doctor, and we'll cover these situations at the very end of this video. In adults, there are lots of possible causes for constipation, and these include the following things. First of all, not eating enough fibre, which is found in foods like fruits, vegetables, cereals, grains and nuts. Not drinking enough water, not moving enough and spending long periods instead sitting or lying down, often ignoring the urge to go to the toilet and instead holding your poo in, changing your diet or your daily routine. A side effect of some medicines can also cause constipation, as well as stress, anxiety or depression. Now, constipation is also common during pregnancy and for about 6 weeks after giving birth. Rarely, constipation may be caused by a medical condition, and if you're caring for someone with dementia, constipation might easily be missed. In this circumstance, you should look out for any behaviour changes, like them becoming more agitated, as it might mean that they're in pain or discomfort from the constipation. So now we know some potential causes, well, how can you treat and prevent constipation yourself? So the first thing to mention is that you should try making simple changes to your diet. This is really crucial and important in preventing constipation. The dietary changes that I would recommend are drinking plenty of fluids, avoiding alcohol, and increasing the amount of fibre in your diet. Now, to increase fibre, think about adding some wheat bran, oats or linseed to your diet. Other foods that you could think about adding are things like apples and bananas, lentils, chickpeas, dates or nuts, so things like walnuts and almonds. In terms of drinking water, I'd recommend that you try to have a minimum of 1.8 litres a day, but again, this is going to vary from person to person depending on your size.